Scientists around the world are currently working on at least 20 different coronavirus vaccines. The WHO is coordinating research efforts globally and sharing data. Contributing to that effort, Canada's federal government is making $27 million available to researchers in this country to work on testing, prevention, and to help people cope with the social isolation that may come with quarantine. Daryl Falzerano is one of those researchers. He's a professor of microbiology at the University of Saskatoon. And Maxim Berezovsky is receiving funding as well for his work at the University of Ottawa. Welcome to you both. Thank you for being on the program. Professor Falzerano, I'm going to start with you. How significant is this investment of $27 million into research on COVID-19?
Sure, it shows that this is a serious situation and the government is willing to mobilize funds really rapidly to build capacity in our country to respond.
Professor Berezovsky, initially the government was talking about providing about $7 million for research. It received so many applications that they increased that by another $20 million. What do you think that says about what's happening in Canada right now in response to this virus?
Oh, it's a significant increase because it will speed up the research and we will deliver the products much faster than before.
And there is, I guess, an incredible amount of interest in this. And this is obviously national interest, but amongst the research community, the academic community, what kind of conversations are happening with you and your colleagues?
So first of all, it was organized very quickly, and we were surprised that the government could do that. And the funds were approved almost in a week. So we are ready to start the new development of the diagnostic tests in my case.
Okay, we're going to get to that in a minute. I want to go back to Professor Falzerano for just a minute from the University of Saskatchewan. I believe I misspoke there a moment ago. I want to talk to you a little bit about your research, bring you in as well. You are looking at animals, if I understand correctly, to see how the virus is transmitted and if vaccines can be effective using that as a model. Can you give me I don't want to quite say for dummies, but maybe the simplified version of how your research works?
Of course, right. So to test vaccines, especially vaccines, but antivirals as well, you need to have an animal model at some point. And so the first thing we're doing is working on developing what would be the most suitable animal model to answer the questions that we need to answer, which are can a vaccine be effective? And also, can that vaccine be safe?
So what kind of animals are we talking about?
Right, so we're starting focused on ferrets, but we are not limiting ourselves to that. So we are looking at a number of other animals as well, mice and hamsters, as well as chickens, turkeys, and pigs. And not even limiting ourselves there. We'll use whatever we need to use, although we think ferrets are going to be probably at least a very good starting point.
I did not expect to talk about ferrets on the show when I woke up this morning. That's fascinating. But I think the thing that we don't want to get distracted from, the question, of course, that people are asking at home is how long might it take before we can see some sort of vaccine? I talked about it in the intro that there are projects being worked on across the world. But what's a reasonable time frame for some sort of vaccine, do you think?
So us, as well as multiple places around the world, have vaccines already made. For example, ours we're going to start to test next week. That doesn't mean it's ready to be used in humans, of course. So really the timelines everyone are basically agreeing on is that in the year to year and a half is when you may see something that would be deployable to a large segment of the population. And certainly I don't think before then.
I just want to ask you, I mean, you look at the incredible interest in this worldwide right now, and there are people around the world racing to find a solution. How does it feel to be so close to testing your vaccine, not knowing whether or not you might be the person who can help resolve, a complex and troubling situation?
Sure, and in a weird way, of course, it's somewhat exciting, but we'd rather this whole scenario, wasn't existing in the first place. But this is why we do what we do, right? So we normally work on emerging diseases in my lab. We previously worked on MERS, trying to make vaccines for them, and we're using what we've learned there to translate this to SARS coronavirus 2.
So presumably from camels to ferrets, I should say. We want to bring Professor Berezovsky in here as well. Now, you're looking at the diagnostic side of things, trying to find a faster way to test people. Tell me a little bit about that.
So my lab is specializing on detecting specific molecules like virus molecules or bacterial molecules in samples. So we're developing simple diagnostic for home use. So technically it's a paper-based.
And this is a sample? If you just hold it up a little bit higher here.
Yeah, exactly. So it's simple diagnostic where you can put a drop of saliva and test in 10-15 minutes the presence of the pathogen, like a virus. So we did it for several other viruses, but now it's time to investigate and make a diagnostic for coronavirus.
Okay, so let's optimistically assume that you were to be successful with this kind of research. How would that change the situation that we're facing right now if it were that easy to test?
It will be better for people when they're scary that they are, for example, they acquire a virus and they don't know what to do. So this diagnostic will cost $5-10, so you can buy it at any drugstore, and then if you test it, so at least you see if it's time to go to the hospital, so you don't need to rush to the hospital immediately when you have a high temperature.
So you're hoping that it would limit transmission then as well?
Absolutely. So if it's positive, you can stay home or contact the hospital remotely, and then again decide what to do next.
I wonder, again, I'll ask you the same question when we're talking about time frames. Obviously, none of us can predict the future, but how quickly would you hope that something like this could be put into effect?
So we plan to deliver a prototype in 1 year, and in 2 years to have a kind of a working device.
Okay. Professor Falzerano, I want to come back to you and just ask you, I mean, you talked about a year to a year and a half. Professor Berezovsky's talking about a year. And yet we see the situation evolving from day to day. I guess I just wonder what you would say to the public who might be feeling anxious. I'm sure that both of you gentlemen and your colleagues are working as fast as possible.
Sure, yeah, these things unfortunately take time. It's almost impossible to prepare for a virus that didn't exist 3 months ago. And certainly people hope that we move faster. Really, the antiviral people are the people who may be able to have products ready, available the soonest, especially with some repurposing of approved and/or experimental drugs that have been in humans already. And that's the direction people are going at the moment as a sort of a stopgap measure until a vaccine could be ready.
I wonder, when we look at the fact that this is a global issue, how much of this actually relies on networks, not just within Canada, but sort of international networks when you're doing this research?
So absolutely. For our grant, we have partners across Canada, but we participate in international phone calls twice a week with various other people. So we're all letting each other know exactly at what stage we're at, and so we don't duplicate each other's work, and so we learn from each other's work and move forward in a complementary fashion. I think the amount of cooperation and collaboration worldwide is actually probably quite unprecedented in this case.
Do you feel, I mean, so much of the coverage around this is deeply concerning, frankly, given that you're focused on solutions, you're having the kind of conversations you were just talking about. Do you feel encouraged or a mix of encouraged and concerned, I wonder?
Sure, absolutely. We all hope that quarantine works, right? And we don't need, quarantine and control and isolation of infected people works to bring this under control. Although I think we're getting closer to a scenario where that may not be the case, although it still is possible, I think. Yeah, it's concerning, and we don't have anything we can do to stop it at the moment, other than sort of really traditional quarantine practices. Mm-hmm.
Professor Berezovsky, I want to talk about that too, but more along the lines of lessons we can learn from other countries when it comes to what you're focused on, which is diagnostics. I think maybe a lot of people have seen online those images of the drive-through testing in South Korea, for instance. Are there lessons broadly, are there lessons Canada can learn from other countries? There's certainly some examples out there, I think, of what not to do, but what we could be doing.
I think Canada in a good position because we had the SARS outbreak several years ago, so technically all officials and all hospitals know what to do because they already experienced that. So we need to be quiet and we need to understand that, so the virus, it's not deadly as people imagine. So people can handle that, and if you feel uncomfortable, so better to contact the officials, but the rest, it's you should consider as a regular flu with the practice, same
Wash your hands, cough into your arm, stay home from work. Listen, gentlemen, we thank you both so very much for making time out of your day to talk to us. And of course, we wish you both very well with your research. I think everybody does. Thank you so much, Maxime Berezovsky of the University of Ottawa and Daryl Falzerano of the University of Saskatchewan.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.